Hello, and welcome back to Partnership Live, our monthly discussion with New Jersey leaders who are changing the paradigm in maternal health. I'm Mariekarl Vilceus-Talty, and I am joined here today by the incomparable Julienne Cherry, who is the president and CEO at the United Way, Greater Union County. Hi, Ms. Cherry, how are you?
Hi, Miss Marie Carl. How are you? And thank you for having me.
Absolutely. I feel like we have so much to talk about and we only have half an hour and I'm like, what do we talk about? What do we talk about? But let's start with a very easy question. I know that you're very civic minded. You do a lot for the community. So if you were not doing this particular job, what would you be doing? What are your hidden talents?
So that's a great question. I always introduce, even though I have all these great titles as, president and CEO, I'm also a councilwoman for the city of Plainfield. But the title that I love the most is mom. I would absolutely be a stay-at-home mother, a stay-at-home wife. I would just make sure that my house is together. I didn't work for almost 6 months, and that was the first time in almost 26 years that I didn't work, but I love every 6 months of that. Um, Another thing that I would do, I would become a doula. So a
Well,
lot of
you can come
people,
to the partnership for that. It's not a
so I wish
dream you can't
I wish that
achieve.
my time allows that. But, honestly, I would become a doula. I had a horrific birthing story. And for me, one of the things that I'd like to do is to pay it forward and be an advocate for someone that lives in the Black and Brown community to know that someone is a voice for them.
Mhm. That's an excellent answer. There's nothing like being a mother or being a surrogate mother or being a bonus mom, raising society's next participants and world changers and paradigm changers is very, very important. And then being a doula is also helping usher in life and giving voice to the voiceless and being an advocate for those birthing families. So wonderful answer to my great question. Thank you
Yeah.
so much. But let's get to the nitty gritty. So you are the president and CEO for our great the you
United Way of
United
Greater
Way of
Union
Union
County.
County. There's so many different United Ways. It's a national organization, correct?
Correct.
So specifically, you are in Union County. So tell
Correct.
us what is the difference and what specifically do you do? Share with us what you do in Union County.
Sure. So just to give some kind of like clarity, so United Way worldwide, there are United Ways across the United States. And I would say historically, people look at the United Way as an organization that will just fund community nonprofits. So we do that. We fund 25 plus community nonprofits. But in the state of New Jersey, our United Way is very unique because we fund, but we also do direct service programming through our Family Success Center, where anyone can walk in off the street to get access to utility assistance, rental assistance, food assistance, maybe diapers, maxi pads, any resource for them to really thrive. And as that individual walks through the door, the services look very, very unique. It could be someone that's looking for workforce development. So now we're doing resume building. It could be a mother that's having some difficulties with her youth. So now it's parenting classes. So that is one of our direct service programs. And then we also run our New Jersey Youth Corps program, where youth between the ages of 16 to 24 could self-enroll in this program. It's a 20-week course, and the youth, if they enter in at like let's just say an 11th grade educational level, our goal is really to graduate that youth and get them to a graduation. If they enter that program at maybe a 6th or 7th grade educational level, our goal is to really identify workforce opportunities for them. So really identify through our corporate partners or community partners opportunity for employment. And then we also provide some community service. Each youth has to do 10 hours of community service every week. And then we also do health and education, and we do a life skills component. So we fund, but we also do direct service.
Mhm. So in part of the youth development, are there specific referrals? Can you be from the high school? And can you be from the neighboring town? What happens then?
So because we are specific to Union County, Greater Union County, we service all of the Union County cities and North Plainfield and South Plainfield. So that is
So
the
what are those cities
prerequisite
specifically, if we're talking about
specific.
greater?
Correct.
Right.
And we were just awarded a grant by the County of Union to do truancy and education and workforce development. So we're marrying our services. So while we are in those high schools, we are
Mhm.
working with the superintendents and the principals to identify students that for some reason or another, the traditional way of learning does not work for them. So they enroll in our New Jersey Youth Corps program.
That's excellent. So you said that you were in the high school. So where's your location? Are you specifically in the high school?
So
Tell us about.
we're located right now in Roselle, New Jersey, but we're looking
Mhm.
to relocate somewhere in the Elizabeth area just to keep
Mhm.
our footprint. Our United Way building, we're moving from Elizabeth to Rawway. So we want
Mhm.
to keep our presence in the Elizabeth area. So we work within the high schools of Hillside, Rawway, Roselle, Linden, and Elizabeth in
Okay.
Plainfield. So we're working
Okay.
with those students to really address truancy and then also marrying our family success services on top of those family needs.
I love the way that you're threading into my next question, because we have family success centers, and I know that you also have a family success center in Hillside. So where is that and what do you do there?
Yeah, so through our Family Success Center, which we just moved from the elementary school to now the high school, again, it's a walk-in center. And I would say in the past, one of the things we've done is we've put Band-Aid on, we've done Band-Aid solutions. We have. If a person is food insecure, one of the things that we've done is we've provided them a gift card. We're taking that next step. So what's very unique about and exciting about how our team is really providing these services is that somebody may walk in off the street and say that they are food insecure, they don't have access to their next nutritious meal. Yes, we will give them access to a gift card to a supermarket, but we also will provide them a box of food. We'll provide them resources in the community for them to eat and identify free food. All right. And then we also ask them, what's the issue with employment? Okay, so now we start going into workforce development. And it's
Mhm.
also, let's help you get your resume. Let's help you
Mhm.
get back in the workforce. Now, if it isn't workforce, then maybe it's training. One of the things that I strongly believe is that education is the key to success. So as much
Right.
education that we're providing that family for them to thrive is a win-win situation for both.
It's very important because it's not only about surviving, but it is about thriving,
Correct.
right? So it does appear that not only are you the convener and the linchpin in Greater Union County, how do you determine what organizations you're going to work with? Because you do so much. So how do you determine which organizations you work with?
Sure. So United Way, we have four pillars. We have education, you have health, economic mobility, and we have youth. So anything that really falls under those pillars, we
Mhm.
will fund and we will work. So we convene those like-minded programs. So if an organization within the Greater Union County is providing access to basic needs for our family, anything at our Family Success Center, youth, financial stability, those are the partners that we want to make sure that we're partnering with. So an organization, let's use, for example, the partnership. We used to work with you in the past, right? One of the things through our Family Success Center, right? One of the things we're doing now under my leadership is we're starting to say, how do we provide our mothers access to those services, those basic needs? We're working, and I've always said it doesn't need to be necessarily we're going to fund you, but let's cooperatively work together so that we're providing our community the resources for them to thrive. So an organization that, many times we'll get a family that may call in that say, I'm 5 or 6 months behind in rent. Our community partners that we fund and some other community partners, we call them and say, listen, we may not be able to close the gap for the 5 months, but collectively we can do
Right.
this.
What can we do? Absolutely. And you said we used to work together in the past. For many, many years, we worked with our nurse family partnership and home visitation program, and we're working together quite extensively right now. So when we talk specifically about the maternal health needs that are in the community, how can we ensure that our residents are getting the support that they need?
I think education is the key, I mean, and I'll give you my birthing story. I gave birth a month early and I had a plan. I had a plan to go to this hospital, the doc, everything was set up. But I ended up deviating and I went into another hospital within an urban area. My doctor was on call on that specific day. Um, but I think as a first time mother, I wasn't provided all the tools. You know, I'm first generation. My mother wasn't giving me all the information of, listen, when you give birth, these things are going to happen to you. Well, no one walked me through that. My OB at the time, he just said, you know, this is the date that you're going to give birth, and talk me through the pregnancy, but really no one walked me through the after and the advocacy. And, you know, you should watch out if you have a fever, preeclampsia. No one really provided that level of education. So I think that going back to education is key. We need to sit down in our communities and inform and educate. And whether that's through a doula, whether it's through the partnership, whether it's through family success centers, that resource needs to be provided. I'm a big proponent of, if someone comes to a food pantry to receive food, let's also lay over different services.
Correct.
That's where the partnership needs to be there. That's where, our family success center, we're also pitching our youth corps program. We're pitching everything in that family structure, because I'm always worried about that one mother that is taking the last $2 or $3 on the bus to go back and forth, and she's going there to pick up food, or she's going there to get access to resources. My thought is that let's layer as many resources as possible for that family.
It's definitely about wraparound care. It
Yeah.
should not be, should I buy food for my family? How am I going to get transportation to my physician's visit? So
Correct.
it's really that wraparound care that we need, you know, clear
Yeah.
delineation of how that's going to
Yeah.
happen.
And also looking at the family in a holistic, how do I make this family whole? Not just putting the Band-Aid, but how do I make them whole? How do I not just help the mother, but also help the spouse that's struggling? How do I help the abuela, the grandmother that's in the home?
Right.
Because then there's senior services. So it's, you know, because it's, no one else should have to make that difficult decision of, do I purchase food or purchase maxi pads, or purchase food or diapers? Do I purchase food or get access to, you know, health of services? Or do I can't do this because I have to go take the parent to a physician? It's all these, the current family structure right now in New Jersey is being pulled in so many different directions. And our nonprofits should come together and really provide those resources for our families to thrive.
Absolutely. Well said. I love the collaboration. We are definitely the linchpins to making that happen. And because you provide so much for the community, talk to me about a program that you're particularly proud of.
So I will say it is, again, I'm everything menstrual equity and period poverty. So in my career, I would say this, while I was working at the Community Food Bank of New Jersey, I started there probably in 2009. I left there in 2020, but while I was there, I started what we call the period program. 1 in 6, well, actually it's 1 in 7 menstruating individuals don't have access to an absorbent material. So
Mhm.
while I was there, I started that program, and it was just providing access to basic needs. It was tampons, the menstrual cups, it was maxi pads, you know, and just making sure our schools, our food pantries, our shelters just had access to basic needs. I think that this is a solvable solution. You know, I think I was instrumental on the very early on in helping legislation pass and really forming that bill. And last year, it finally passed where we
Yes, the
allowed,
period poverty.
yep,
Mhm.
allowed students access to absorbent materials in school. There's still more work that needs to be done. So that's one of the programs I'm just extremely proud on the health.
Before you go on, because I'm not sure if everybody really understands the impact of period poverty. Can you share with us, what does that really mean? Because some people could say, well, what's the big deal? You don't have a pad, you know, is it that they can't afford it? But talk about the trickle down effect that has.
So think about the working mother. So I think one of the worst stories, the hardest stories that I had to listen to when, you know, when I used to walk the pantry line and have conversations with um, the pantry with food recipients, one of the conversations that a recipient said to me was, I have to miss time away from work. And I oftentimes will just lay a towel down and just bleed. So if, again, then let's just not talk about period poverty. We could also marry that with food insecurity, diaper need, and the period. Let's just marry those three. You are a mother that just gave birth, you're going back to work, and then now you cannot afford food, maxi pads, and diapers. So what we know is that if you don't have access to an absorbent material, what are you doing now? Are you going to work? Or are you missing time away from work? Many menstruating individuals miss time away from work because they don't have access. And
Right.
then also remember about, listen, they're using, washcloths, paper towels. We as nonprofits, we need to, provide the resources. One of the things that I've done is provide free access to maxi pads and just different avenues, different buildings in
Mhm.
our building. And I think in our state buildings, county buildings, those materials should be free. I hate when I look at a little thing on the wall that says 25 cents. Come on.
You can't find the quarter, you can't find the dime, you can't find a
Yes.
nickel. Yeah, it is a trickle
Yeah.
down effects that affects the family, the economics, the education for many young girls.
Mental
Yeah.
health. And then
Mhm.
also think about the mental that is now having on that mother because they don't have access to that material. And no one should have to make that difficult decision of, do I purchase food or do I purchase maxi pads?
Right. You're absolutely right. Absolutely. And I did cut you off because you were going to talk about another program that you're particularly um fond of.
I love our Family Success Center. I've worked 26 years in nonprofit. And within the 26 years, whether it's food insecurity, advocacy, reintegration back into society, working with youth that are in foster care, our Family Success Center, we have reimagined what it looks like. So when I came on board, we were doing the work, but I've been pushing my team to really do the work and really
Mhm.
reimagining just kind of like how we service that whole family. And within since I've been here now 10 months, we've been seeing the continuous, the trust. Our families are
Mhm.
trusting us. They're coming back to receive the level of different services. So when,
Mhm.
we just
Mhm.
started our VITA program, which is our tax prep program. Um, our recipients that are in the Family Success Center, while they're receiving those basic needs or the parenting classes or resume building, they're also saying, oh, I can also get my taxes done here for free. So we've become the wraparound service. We've become the trusted face. And what I love is that when I see that familiar face and they look at me, they're like, oh, hi, nice to see you
Yeah.
again. And then I do the check-in with them to say, hey, so how last I remember you weren't employed, or how's the baby? Show me pictures of the baby. I love to see the growth within our
Mhm.
families.
Wonderful, absolutely true. And I want to go back to just talk about the Family Success Center because there might be someone who logged on for the very first time. Welcome. And they're like, well, Family Success Center, what is that? Is it a distribution center? Are you just going to get like what is a Family Success Center? We both have them and we understand how vital they are to the community. But for those of us watching who are not sure what the Family Success Center really does. Can you share with us what you
Yeah.
do?
Yeah, and I would say, the basic, I think the overall theme of all Family Success Centers, it is a walk-in center for anyone that is in the community where resources are provided for that family structure to thrive. All right. And thriving would be, it could be parenting classes. It could be on how to do breastfeeding. It could be rental assistance, utility assistance, diaper need, providing access to an absorbent material for your menstruation. It could be resume building. It is anything. It is anything really for any resources. It is applications to complete for SNAP. It could be SNAP education and nutrition education classes. It's just really just the amount of just different resources, and we
Yeah.
define that as we start
Mhm.
seeing the different needs happen throughout the community. Right
Correct.
now, one of the things that we're doing right now is digital navigation, how to
Mhm.
navigate through the internet and showing our seniors, showing our members that are coming walking through the door. Now it is daunting. Sometimes it's very daunting if English is not your first language, and now you're getting on the computer. So we're
Mhm.
helping them navigate safely online.
Mhm. Julian, can you tell me about how many languages do you have? I know we have quite a diverse network of employees. So in your Family Success Centers, I know in ours, we're seeing an increase of undocumented people that are sometimes afraid to come to our services because they think that we need your documentation, we need your social security number. Can you talk a little bit about that?
Sure, sure. We have seen every every race, every nationality. We've seen just about everyone from the cities, the 21 count, the cities within Union County. Easily we've seen it. And even in our affluent areas, one of the things that we've done through our resume building, we're reimagining. It's not just for someone that has not been employed. We've seen families that, they've been the stay-at-home mother for countless years. Now their youth or their child has graduated, and now they need to reimagine what their next career looks like. So through our Family Success Center, our resume building, through our workforce development, we're sitting down and saying, let's help you navigate this thing called LinkedIn. Let's help you
Absolutely.
navigate,
Mhm.
recreating a resume and writing a
Mhm.
resume. So those things could be very daunting to someone
Mhm.
that hasn't worked for countless years. And that's
Yes,
just
yeah.
not in
Right.
our underserved area. We're seeing this throughout all
Everywhere.
of our
Mhm.
cities.
Yeah,
And we
yeah.
help walk people through that.
Yes, so it's really an area to really, like we said before, help people not only survive but thrive. And we'll have more information on that because we are working together on April 9th for a specific webinar, right? About
Yes.
family success centers, with ourselves, the partnership with you, United Way of Greater Union County, I believe Highlands and New Destiny, to talk about family
Yes.
success centers and how integral they are to the community. And I know our time is ticking away. Just a couple more questions. Is there any, I know you're doing a lot. You have a lot of events going on. So what's up next on your calendar?
So the most exciting thing that we have, again, we're our dynamic team of 18. I think that we work amazing. So I just want to shout my team, give a nice little shout out to the United Way Greater Union County team. I could not do it without them. I often tell them, listen, even though I lead the organization, they run it and they make the community, they provide the resources for our community to thrive. And I'm just so thankful that I work alongside of them. But one of the exciting things that's happening, that's coming up in May, is that we have a concert on Mother's Day. It's going to be at the Union County Performing Arts Center in Rahway. And we're gonna host a Mother's Day concert. There's going to be the Stylistics, the
Oh,
Tramps, the
oh,
Intruders, Melvin and the Blue Notes, and then
really?
and then the Delphonics.
Oh,
Yes,
wow.
yes.
What date
Tickets
is
are
it? Let
going,
me put this on my
it's going to be
calendar.
Sunday. There you go, Sunday, May 12th at 3 p.m. And
Okay.
the show is selling out. I mean, like within 1 week, we've sold almost 200 tickets just in 1 week. The seat, the
Can I
the
get a
the theater
ticket?
holds.
Can I
You
say that I
can,
know somebody? I can get a ticket. Okay. Okay,
you
good.
sure can. You absolutely can. There's sponsorship opportunities. There's tickets. The tickets range between 37 to 100. 100 is like a VIP, but it is going to be a great show. And not only that, it's all the proceeds from the show will come back and support our families in the Greater Union County.
Wonderful, wonderful. That is just really, really exciting. So my very last question is, if you were told, here, I need you to write a book of your life thus far and all of the great work that you've done, what would be the title of that book and why?
I think it would say the title would be Impact and then an exclamation. So one of the things I pride myself is that every day of my life I've been impactful. Every day, every single day. And whether it's, working with adult male inmates, working with juveniles, working with food insecurity. I mean, working in nonprofit is not for the weak. It's hard. It is really hard. I know that if God called me tomorrow, that he would say, Julian, come on in. We got you. But I've made an impact. And I'd like to probably document my autobiography of everything that I've done, just so that my son is able to read that and be proud of my legacy. And then my grandchildren are able to see this. I've won countless awards, but I've always kind of like said, no, 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 I don't want to be recognized. But I would write that book would be about my impact, exclamation. And then it'd be like, my legacy continues.
Fabulous. Thank you so much. You are quite an impactful, phenomenal woman. And when you show up authentically, the universe
Mhm.
really does shift. We're going to have you back because there's so much more that we need to talk about, your life, what you did, and,
Mhm.
that all of the impactful work that you have completed. So thank you so much for sharing this short amount of time with me, about your presidency which is phenomenal in your, 10 short months at the United Way of Greater Union County. We look forward to working with you so much, and please save me a ticket. I will definitely be there.
Got it. Thank
Okay.
you so much for your support.
Absolutely. And thank you for joining us at Partnership Live, and we look forward to seeing you next month. Bye-bye.